My name is Rachelle. Welcome to my neighborhood pharmacy. So here we are in the dispensary again, and we've addressed the important role of the pharmacist with respect to making sure that you get the right medication. You know, when the doctor has written a prescription, that you get the right medication, it's in the right dose and the right strength. A couple of other things that have been happening as our healthcare system is evolving is the governments have given the pharmacists greater responsibilities in the healthcare system, and some examples of this are that the pharmacist is allowed to adapt a prescription and the pharmacist is allowed to extend a prescription. What does that mean? Well, in the old days when they sent us a prescription, if the prescription was for a child and the doctor accidentally wrote for capsules, and you know that the child's going to do a lot better with a liquid form of this, in the old days we would have had to call the prescriber and ask them to change it. In the new world, the pharmacist can adapt that prescription. So if we happen to know that you're having difficulty swallowing and the doctor has prescribed pills, yes, we can convert that to a different dosage form. This is called an adapted prescription. The pharmacist has adapted the prescription. And what you'll notice that instead of the doctor's name being on the prescription label, it's going to be the pharmacist's name, and that's because the pharmacist has taken responsibility to alter the medication. Now, we are allowed to alter things like dosages and strengths. So if something's not available, we can just flip it to a different strength. If a certain dosage formulation isn't available, we can make a change to that. So that's called adaptation. The other important thing that's happened is that the pharmacist has been able now to extend a prescription. So that means if your prescription has run out and you have a doctor's appointment next month and you can't really get in there any sooner than that, but you definitely need this medication. What the pharmacist will do then is do an assessment. So let's use the example of it's a blood pressure medication. So if it's a blood pressure medication, the pharmacy will usually have some kind of a blood pressure device. So we might have you come into our private counseling area, and we might measure your blood pressure, and we might ask you if you're having any side effects. Some of the side effects are very obvious things. Certain blood pressure medications can have you coughing, so we might ask a question, do you have a dry cough and you don't have a cold? We're going to do a little assessment to make sure that the medication is right for you and you're not having a side effect. So we'll measure your blood pressure. If it's really high, the pharmacist, in addition to extending and adapting prescriptions, can also adjust dosages of the same medication. We cannot switch you to a different blood pressure medication, but we can certainly make recommendations as to whether that dose should change. But for sure we can extend it. So no more fear now of running out of pills and having to go spend time at the walk-in clinic, because the pharmacist can extend that. That is pharmacy extension. Now, anytime a pharmacist touches a medication, they have to put their name as the prescriber. They're also obligated to communicate with the prescriber that the pharmacist has done this. So if I extend your blood pressure medication after I've done an assessment, I will notify the physician that I, Rachelle, did an assessment with the patient and I've decided to extend the prescription refill for 1 month because you've told me that your appointment is in a month. If you're in the situation where you don't have a family doctor anymore, which happens a lot in remote Ontario and in remote Canada, there aren't enough prescribers. And so what we can do is dispense an authorization up to the length of time, the last time up to 6 months. So if patients don't actually have family doctors any longer, as long as they're coming to the pharmacy to allow us to do assessments regularly and measure the blood pressure, we could authorize a refill for up to 6 months. So that's good news for you and taking care of your health. And I'm not sure if everybody knows that pharmacists can do that. So here we are in Ontario for sure, and in many provinces in Canada, you're able to have the pharmacist look at your prescriptions and renew them for you.